So I want you guys to understand what's happening when you get a back spasm. There's an injury to a disc in your back, and your body is trying to protect that disc to unload it by spasming, to contract those muscles to pull the load off of the damaged part of that disc. So the back spasm, despite how uncomfortable it is actually protective for you. So when you understand that, you realize that taking a muscle relaxer is not the ideal situation for you. You're inhibiting the protective mechanism, and honestly, muscle relaxers pretty much just put you to sleep. So the name of the game is to unload that disc, right? So 3 things you need to do. You need to watch your activities, and that comes with an understanding of knowing what makes disc problems worse and what makes disc problems better. For the majority of people with disc injuries, again, majority, not all, discs have different presentations, but the majority will not tolerate sitting well and will do better with standing and walking. So you would want to do more standing and walking and minimize the amount of time you're sitting. And again, that's all with the intent of unloading the disc. Even if you're having spasms, you still want to try to unload that disc with these activities. Next thing, once that spasm calms down, we need a healing environment for that disc, and that's brought on by 3 things still. We still need the healthy activities, but we also need to restore range of motion. We need to, A, check it, make sure that there is a range of motion problem, and if there is, we need to restore it, fix it, get things moving well. And that's not just the back, that's the hips also, and in some cases that can be the upper back and the ankles and the knees. Everything needs to move well to unload discs. And then finally, the last thing, you want to look at strength. Does this person have weakness somewhere? Do they have muscle imbalances with certain movements, certain muscles? That needs to be addressed as well. The way that you unload damaged tissue is to restore range of motion, restore strength, and then make good choices with the activities you put through your body. If you have any questions, reach out. Have a good one, guys.